Ayurveda. It's one of the world's oldest healing systems, just packed with thousands of years of wisdom. But what happens when all that ancient knowledge hits the reality of a modern clinic? Well, today, we're going to dive into how technology isn't just closing that gap, it's actually shaking up the whole practice from the inside out.
So here's the heart of the problem. On one side, you've got this incredible, deep well of knowledge. But on the other, the tools being used to apply it are, well, they're just as ancient. We're talking about handwritten charts, endless manual calculations, and just stacks and stacks of paper. This creates a real bottleneck in today's healthcare world.
And this isn't just a small issue, it's a huge challenge. That whole manual process, especially for something as critical as creating a diet plan, has become this major roadblock. It's slowing down care, and honestly, it's holding back the true potential of this amazing practice.
Let's just break it down a bit. For doctors, building these personalized diet plans by hand is incredibly slow. It just eats up so much of their time. And of course, anytime you have manual work, you're going to have human error, which can seriously affect patient safety. At the end of the day, all this limits patient results because practitioners just don't have good, reliable data right at their fingertips.
So, how do you fix a problem that's been around for ages? Well, you bring in a very modern solution. It's time to talk about AURA. It's a clinical intelligence platform that's basically saying, Ayurveda, meet AI.
So what is AAYURA, really? Well, at its core, it's an AI-powered platform built to merge cutting-edge tech with that incredible ancient wisdom. And the goal here is absolutely key. It's not about replacing doctors. It's about empowering them, giving them a powerful new set of tools to basically supercharge their expertise.
Okay, so that sounds cool, but how does it actually work? Like in a real clinic with a real patient? Let's walk through that journey, from the second a patient walks in the door to the moment they get their own unique, personalized plan.
The whole process really happens in 4 main steps. First up is patient profiling, where the system gets to know the patient's unique body type. Right after that is plan generation. The AI instantly creates a custom diet plan. Then, and this is crucial, comes the holistic review, where the doctor uses the platform's insights to fine-tune everything. And finally, there's continuous monitoring to track progress and make sure the plan is working. It closes the loop on their care.
It all kicks off with something super user-friendly, an AI chatbot. It doesn't just ask boring questions, it's engaging. And its whole job is to figure out the patient's unique Ayurvedic body constitution, which is known as their Prakriti. This is the absolute foundation for everything that comes next.
But it doesn't just stop at Prakriti. The AI is smart. It pulls together a whole bunch of other factors. It looks at the person's age, their gender, and even the current season. Because in Ayurveda, all of those things matter a whole lot when you're talking about diet.
But here's where it gets really cool. AARR is so much more than just a fancy automated checklist. Let's take a closer look at the features that make its approach not just smart, but truly holistic. Okay, this right here is the game changer. It's called dual analysis. For any food, let's say an apple, the doctor sees 2 sets of data side by side. You've got the Western nutritional facts, calories, fiber, sugar, and right next to it, you see its Ayurvedic properties, like how it impacts the doshas. This one feature is the bridge that finally connects ancient wisdom with modern science. It's incredible.
And get this, the platform is also looking out for you. If a doctor is about to add a food that might throw a patient's system out of balance, a smart alert pops up flagging it as a problem food. But it doesn't just leave you hanging. It then offers a smart solution, suggesting safer alternatives and even different recipes.
Look, all this amazing tech doesn't mean a thing if people can't actually use it, right? And that's why AAYURA was built for India's diverse healthcare system from the ground up. It supports over 10 Indian languages, it works great on a phone or a computer, and it's built on a secure, HIPAA-compliant platform that's ready to integrate with hospitals.
The features are seriously impressive, for sure. But what's the actual real-world impact? Let's get into the data and see what kind of a difference this digital transformation is really making.
Just looking at this, the change is, well, it's huge. This shows how much time doctors spend on administrative stuff, charting, diet planning, all that paperwork. The difference between the before and after is just night and day.
Let's put a hard number on that. We are talking about a 90% reduction in all that charting and admin time. That is time that doctors get back to do what they're actually there to do. Focus on their patients.
And it's not just about speed, it's about safety.
By automating all those calculations and giving doctors those smart alerts, the platform cuts down on prescription and dietary errors by over 40%. That is a massive leap forward for patient care and safety.
And the impact just keeps spreading. You see, better plans and that continuous monitoring means patients are more likely to stick with it. It modernizes the entire clinic, and it lines up perfectly with the Ministry of Ayush's goals for digital health. At the end of the day, tools like this help push the entire country's health forward.
So it all comes back to this one simple but really powerful idea: bridging timeless Ayurvedic wisdom with modern clinical intelligence. It's all about honoring the past while building a smarter, safer, and more effective future.
And that really leaves us with a big question to think about. AAYURA is an amazing example, but it points to something much bigger. How can all of us, whether we're patients, doctors, or innovators, how can we keep supporting this incredible fusion of ancient wisdom and modern tech in all parts of healthcare?
And hey, if this whole idea has got you fired up and you want to be part of the solution, the journey doesn't have to stop here. A really great place to see the next wave of this kind of innovation is at the Smart India Hackathon. You can explore and support more amazing projects just like Ayura there in 2025.